Healthcare workers throughout Washington are calling on state lawmakers to pass legislation to help keep them safe and their patients safer. Our Madeleine Hagen spoke with a local nurse who's a part of a coalition that is pushing for change.
The pandemic has exacerbated the problem. It did not create it.
The problem? Overworked and burnt out healthcare workers across Washington state.
Nurses are scared. We're scared for our patients.
Local ICU nurse Nikki May says when you force nurses to work to their breaking point, mistakes are inevitable.
If I make the wrong decision, it could kill.
Nikki, who's a part of the WA Safe and Healthy Coalition, says the problem isn't a lack of nurses.
We have a shortage of willing nurses.
She says nobody wants to work 16-hour shifts, have a high patient ratio, or miss out on a lunch break.
We have too many patients and not enough nurses, and that's what you have to do to get through. Because you can't have a patient not have a nurse, so it's better to have a nurse that's overworked than to not have a nurse at all.
This is why they're urging lawmakers to pass House Bill 1868 and companion Senate Bill 5751, setting standards for patient-to-worker ratios, among other requirements that they hope will improve the work environment.
It's actual concern for patients is the main reason why we really need this passed now. We needed it 10 years ago. We desperately need it now.
Better staffing is linked to better outcomes, and that inadequate staffing leads to worse and sometimes tragic outcomes.
While it may not be an overnight fix, Nikki believes the concept is simple.
If they change how much is on our plate, I think a lot of people would come back.
For KVUE Local News, I'm Madeleine Hagen.
Some people have been concerned about smaller healthcare environments. The coalition says the bill is not a one-size-fits-all approach. The second substitute of House Bill 1868 has passed on to the next step.